According to Understanding the Opioid Epidemic, more than 240 million opioid prescriptions are written for pain each year. Heroin started as the most commonly misused opioid in the 70s as a substitute treatment for morphine. In the 90s, prescription opioids became the go-to drug. In 1996, Purdue Pharma introduced Oxycontin, which led to the spike in opioid-related deaths. According to our lecture, opioids are a Schedule I drug, which means they are commonly and easily abused. Heroin is potent and crosses the blood-brain barrier quicker in regards to metabolism. Opioids release endorphins that block pain. Prior to the 1990s, the use of opioids for pain was limited. The first factor that changed this was pharmaceutical companies telling physicians that opioid pain relievers were safe, efficient, and non-addictive. The second was doctors being pressured to treat pain. Physicians created the pain scale as an aid. The combined factors helped spike prescription opioid-related deaths as shown in Figure 4. An article from the Psychiatric Times says that many prescriptions for opioids are given without appropriate pain diagnosis. However, with physicians believing them to be safe, prescriptions increase dramatically. Different from alcohol, opioid addiction develops quickly and requires treatment sooner. After Purdue Pharma introduced Oxycontin to the U.S. using false advertising, it took its toll. In 1999, opioid-related deaths began to climb. According to the Harvard Health Review, the spike in deaths from 1999 to 2017 had 3 phases: prescription usage, heroin usage, and synthetic opioids. According to the Psychiatric Times, over 300 scientists came together in 2017 to convince the CDC to change the guidelines regarding opioid medications. The guidelines restrict the amount of opioid medication doctors can prescribe with a certain time frame. According to the Psychopharmacological Institute, the initial source of opioids is from family or friends. The source of misuse opioids varies from doctors to drug dealers. People move from prescriptions to drugs like heroin because the strong cravings and physical withdrawal symptoms don't allow them to stop. According to the PBS video Understanding the Opioid Epidemic, treatment that solely focuses on abstinence recovery does not help. People with addictions need to replace an unhealthy habit into a good thing. Adopting Pavlov's ideology to teach addicts to find happiness without opioids can further our treatment in this epidemic. The opioid epidemic continues, but from the PBS documentary Understanding the Opioid Epidemic and the TED Talk teaching is the key to a change in the way we view the disease.